Very good evening, friends. Meeting again in the session of philosophy, and we are discussing regarding the Stuart Close philosophy. We are discussing the chapter, the examination of the patient, and how one can go ahead with the examination. Many aspects Stuart Close tried to explain, as Hahnemann have explained in between the aphorisms 83 to 105. He has given importance to what type of symptoms are necessary, the subjective, how they are important from homeopathic point of view, then the objectives. Also objectives, why importance of objectives in the diagnosis. Many things he has explained. At the same time, he explained that how to explore the patient and find it out the manifestations of the patients the way we required it. Many patients who used to give the vague symptoms, but ultimately it is our duty to complete it at all level, the location, sensation, modality, as well as concomitant. And then he has given the examples of Boningussen's therapeutic pocket book, and he explained the Kent's repertory and Boningussen's therapeutic pocket book. These are the two books, two repertories, in fact, which you have to understand properly, go through that, find it out what are the symptoms which you can locate over there. And with the help of that, then you can know what to be asked and what is given in the repertory. Automatically, your approach will turn towards what is necessary for you and what is there in our homeopathic literature. And that's why he has recommended the two repertories, that is the Boningussen's therapeutic pocket book, only repertory in the field of homeopathy which is based upon grand generalization as well as the inductive logic. Rest of all repertories which are based upon the deductive logic. So this is the difference, because Boningussen have made simply the differentiation, making it more generalized, and because of which his repertory is the quick bedside prescriber and your repertory used at the bedside. So this is what we have discussed. We are on page number 178, and now he turns to explain the importance of clinical histories in the case. So what history is necessary, that's what he wants to highlight over there. Let us go ahead with the page number 178 on Stuart Close philosophy, clinical history. Getting a good clinical history is one of the most important parts of case taking. By the same token, it is also the one most generally neglected and badly done. And this is the habit we the allopathic practitioners or modern practitioners, they never gives time to the patient and they never listens the patient, because history is something which gives you all details, because of which your work is half done, but many times it is overlooked. Many times uh, no one goes into the details of histories. And what Hahnemann and Kent says is very correct, that these are the points one has to take into consideration while dealing with the cases. And then he starts, in order to deal intelligently with the present, we must know something of the past. So if we want to understand what is present, we must go into the past history. For example, today I had a patient of avian. In why that lady at the age of 27, why she is suffering from avian? Unless and until you get the past history, you will not going to understand why she is suffering from a vascular necrosis of femoral head. The past history is very important. Then the question I asked, whether you have suffered from any disorder like COVID, etc., or whether you have suffered from any other disorder. She said, no, I don't know. I never had COVID, but I have taken COVID vaccination and I have started this problem right from that. Then I took the history, whether there is any history, whether you have admitted for the dengue or decrease in platelets, etc. They said nothing. So the whole history, there was no history of use of steroids. She was not addicted to any tobacco habit, smoking habit, alcohol. Still, she had the avian. Then the most probable reason remains that it is because of COVID vaccine. So if it is so, then elements from vaccination is another point which you have to take into consideration in such types of cases. So past history is very important in order to find it out what is present. We must know only the facts of the present, perhaps acute illnesses, but also what led up to it. This is also important. So why this acute has been there? What is the past? That is important. Otherwise, we will often be baffled in our attempts to cure and find out patients making slow and imperfect recoveries from seemingly simple acute diseases or settling down into states of more or less confirmed invalidism. So if you don't go into the history, what is the past of the patient, what is the family history of the patient, then we never know the mathematic aspect. If we just treat acute with the help of acute totality, we're going to treat only the acute. The reason behind that, which is hidden in the histories, we never treat, and that's why the recurrence is the rule. We never get the cure, and for that purpose, the history plays a very vital role. That's what Close wants to say. This is because all genuine acute diseases are in the reality acute outbreaks of exacerbations of previous latent deep-seated underlying chronic diseases or inherited tendencies and predispositions to the disease, which exist in practically all persons, a special subject which is dealt with elsewhere. See, very perfectly he has explained over there. This is why these things are coming up. Why acutes comes? Many a times it is hidden in the history that they have suffered from some chronic illnesses in the past. There might be some illness in the past. There might be history of suppressed sora, suppressed skin eruption. There might be history of suppressed gonorrhea. There might be history of suppressed syphilis. There might be anything which is responsible to produce acute exacerbation of the latent miasmatically. And to find it out that miasm, the past history, the family history plays a very vital role. Here homeopathy differs from the rest of the pathies because here homeopathy deals with the miasm. And once you handle or tackle the miasm, then it becomes rather simple to treat the disease. So very important thing in your case is to treat the not only the present, but also take into consideration the past of the patient so that you can take into consideration whole patient and the roots which are hidden over there. In the examination then, as a rule, and at an appropriate time, we first get as a complete list as possible of the patient's previous diseases from childhood down to the present in a nearly chronological order as possible with the ages at which the attacks appeared and inquire as to their nature, symptoms, duration, severity, and sequelae. See, very important entity which is explained. What he is saying, you must deal with the patient and ask about all the chronic diseases from which he has suffered right from the birth till today and write it in a chronological order. Why it is necessary to write it chronological order? Because then you understand the evolution of the disease right from the start till today. The first chapter, which has been written by the king, the Sikh, in his philosophy, explains very nice example of this. There was a patient who suffered from some skin manifestation who was treated locally. He started getting some vague symptoms. Then the patient they cannot diagnose and then labeled it is something hysterical and they have given tranquilizer. Then disease has transmitted to some acid peptic trouble. Then again he was treated with that. Then he had some lung infection, consumption. Then again he has treated for lung consumption. Then again he had liver cirrhosis. Then again he was treated for that, and then patient landed into encephalopathy. So disease was shifting from less important organ to more important, then most important, and lastly the most vital organ. So this is the way which we can understand how the disease has evolved. If you are able to catch that, then if you are treating that patient at that specific level, and if patient starts improving, the order which will, in the reverse order, it should disappear. That will guide you. Yes, you are on the right path. And for that purpose, as far as possible, write down the history in a chronological way so that every disorder according to the age you will going to find it out. At the same time, what he says, with the ages at which attacks appeared and inquire as to their nature. So what was the exact disease? Second, what were the symptoms? What was the duration of disease? What was how much was the severity? and what is the ultimate sequelae of the disease. All those points are very essential when you deal with such types of cases. Then he says, we should inquire carefully, not only as the acute eruptive infectious inflammatory or febrile diseases, including the so-called children's diseases, but about the most chronic and obscure elements, including skin diseases, organ and glandular diseases like tonsillitis, adenitis, etc., nervous diseases like epilepsy, convulsions, chorea, paralytic conditions, etc., catarrhs and discharges from any of the mucous outlets, bone or joint diseases, and rachitis, all disorders of the sexual sphere, especially syphilis and gonorrhea. He is explaining over there what is necessary for you, what history is necessary in the past history, what exactly you must ask. It should not be only the children's diseases, chicken, measles, chickenpox, measles, or mumps, or etc. Those are the common infectious diseases. Those are not so important. As important are the skin problems, as important are the tonsillar problems, as important are the glandular affections, as important are the bony deformities or bony affections. So disorders which the patient has carried from the past generation, you must ask. These are very important so that it will define you exactly the miasm, which will guide you to find it out exact miasm, and according to the exact miasm, the proper remedy. In women and girls, and then he has explained about all the disorders of sexual sphere, especially syphilis and gonorrhea. These are the points one should not forget if you feel that his present disease is related with these two miasms. Then this history is very much important. So don't get embarrassed while asking the question. If you feel it is there, just ask it in proper words so that patient will also not feel embarrassed and patient will answer you properly. So how will you put your question? That is matter. That is a big important matter which you have to take into consideration. So if in Marathi I used to directly ask की लघवीच्या मार्गातनं काही पस वगैरे येत होता का किंवा लघवीच्या मार्गावर काही पुरळापूर्वी झाले होते का? Is there any discharge from the urethra, or are there any eruptions on the genital organs or urethra before that? If you put direct questions, then you will going to get a correct answer, and patient will not hesitate to give the answers if the question is direct and if it is related with his disease. And always, whenever when you are putting the question, the language matters a lot. How do you ask? That is very important. So it is always necessary to tell the patient, राग नका मानू, पण मला एक विचारायचं. This is the way. Don't get angry if I'll put certain questions, but tell me this is very important from our point of view. If you start with this, then patient will definitely going to tell you and help you regarding all those disorders. If he hides, it will create a problem and we never get exact miasm. And for that purpose, it is necessary to ask the history of syphilis and even gonorrhea in the patient. In women and girls, we should inquire about the menses, age at which established, and regularity of the periods. Note all deviations from normal and ascertain the time and influence of the marriage, childbirth, etc. So these are very essential entities in our case. The menstrual history with the females, those who used to get the menses, it is very much necessary. It is necessary to ask all those details to the patient. If you ask those details, many times certain disorders are hidden over there. Sometimes there is some irregularity of menses. Sometimes there is oligomenorrhea. There was one patient whole history I was conducting. She was suffering from acute rhinitis, acute allergic rhinitis. There was a redness of eyes and everything. And just I was thinking, what may be the reason she was having so much of acute coryza and lacrimal. Then I just put, how are your menses? And she said, doctor, yes, you have asked me very good question. Then I said, why? She said, I used to get menses only on one day and only for an hour or two. Then remedy was fixed. It was euphrasia. After euphrasia, you can find it out a right remedy, constitutional remedy, but you get the right remedy just because a concomitant, which is very important in euphrasia, that is menses last only for 1 hour or 1 or 2 hours. That was very important. So this is what we have to look for. See what not only menstrual history, then you have to ask regarding how many days the bleeding starts. Then how you have to ask regarding abnormal discharges like leukorrhea, are there any? Then you have to ask about the specifically about the when they have married, how many issues they are having, how is their marital life. All those things are necessary in the case. And these histories many times gives or provide you individualization. You get a detailed history, you get a right remedy. And for that purpose, you should not hesitate to ask all those questions which matters a lot in the history. We should not forget to inquire if and when the patient has been vaccinated. This is another point. Nowadays, there are many vaccines. I think list goes up to 50 vaccines. These are the most hazardous things which happens. There are many new more are coming out. And learn what course the implanted disease took. At the same time, we should inquire if or other inoculations with serums and vaccines have been performed. Many troubles may be traced back to the vaccinations and inoculations, intentional or accidental. See, very important thing which he has mentioned over there. Many troubles may be traced back to the vaccination and inoculations, intentional and or accidental. And this is the truth. Just today I have seen that COVID vaccine itself are responsible to produce a vascular necrosis in female. It is very rare in females, very common in males. I had nearly about today's case is 417 cases of vascular necrosis of femoral head, out of which there are not more than 17 in the female cases. Rest of all are males. But then question arises, why she has suffered? You have to take into consideration all those past histories, but nothing was traced back. She said nothing. Only her father and only her mother is having diabetes and hypertension. Nothing, no specific history in the past also. And then question arises, how this has arrived? She said she herself tells that it is because of vaccination. So vaccination can lead to any dangerous thing. I have told you many cases. I had a case, a coma developed after vaccination. Then there are cases, epilepsies after vaccinations. So this history, if it is there, then you must ask it and whether it has any impact on the patient's life. The kind of treatment the patient has had for diseases experience and principal drug and should be learned. And the principal drugs used should be learned, if possible. It may be necessary to antidote some of them. So patient comes to you with some disorder and he has consumed lot of allopathic medication and he had history of many diseases and consumed all those drugs. Many times the present state is because of the drugs which he has consumed plus his original disease. So which might be an artificial disease which developed over there. So in such types of cases, you have to go ahead with specific aspects. You have to understand all those things. You have to take into consideration all those aspects and then you have to do. So if there are any such specific drugs which are used, then you have to consider the antidote for those drugs from homeopathy and you can treat that. This is very important if there are effects of those drugs. So history of drugs consumed, history of all diseases in the past matters a lot for his present state of disease. the kind of treatment the patient has had or diseases experienced and the principal drugs you should be learned if possible. It may be necessary to antidote some of them, the occupation and the habits of the patient, the diet, the exercise, the sleep, the use of tea, the coffee, the tobacco, the stimulants, narcotics, etc. should be noted. So in the history, what are important points? The occupation. We have discussed on that day in length that it is not only just for the occupational hazard, but the impact of occupation on the patient, whether patient likes it or dislikes it, whether patient is doing whatever whatever occupation is, it is forcefully or because of the situation. So all aspects regarding the occupation and their impact on patient's life should be asked. That will guide you to mm, understand that patient's nature. Habits of the patient. Asking the habits of the patient, whether he has any specific habit of tea drinking, habit of tobacco mystery, habit of tobacco smoking, habit of alcoholism, habit of taking the drugs, all matters a lot. Because if they are there, it is your duty to stop them first because your medicine will not going to produce its action. So unless and until you have in the history all those things, you cannot tell the patient. So in the history taking, the occupation, the habits of the patient, the diet is very important. It is not at what time you take the food, that is not important. Yes, it is one point one should ask at what time the breakfast the patient does, at what time he takes the lunch, dinner, etc., or daily routine and diet. But what he likes specifically is what, in fact, likes is not the proper word, what he craves. Craving is very important. If it is craving, it has a meaning. If there is a specific aversion, today that patient told me that she never absolutely don't like milk. This is absolutely don't like milk. It has a meaning. Then you take it as an aversion to milk in the case. So these are things which you have to look for. Then third important thing which he explains that the sleep, very important. Many patients never get sleep early in the night. They sleeps late at 12 o'clock, at midnight or 1 o'clock, 2 o'clock. Then I ask, what's the problem? They said, we don't get sleep. Then what do? They are watching the screen, finished. I used to tell them, if you want to come out of the situation, you have to shut down your or put down your mobiles completely off mode or either for the silent and keep it away from your body and just go for sleep. Even though you are not getting sleep, try to sleep. Early in the morning, wake up early in the morning. You should, even you do get a sleep at 2 o'clock, you must wake at 5 to 6 a.m. Then consecutively do it 3 days automatically and don't sleep in the afternoon. Then definitely you're going next day only you will going to get sleep at 9 o'clock, 10 o'clock. It happens so commonly. You get exhausted, and if you don't get rest whole day, you get sleepy at night, and that's a good sleep which you can get. Afternoon sleep 10 minutes or 15 minutes is more than enough. Don't be more than that. If you are taking it for 10 to 15 minutes, it's well and good. In fact, that will give the strength for rest of the day. And that's why after lunch, if patient has 10 minutes nap, it's good one. But it should not be more than 10 to 15 minutes. If it is more than that, it creates a problem. So sleep is also important, asking the history of sleep. Then he says use of tea, coffee, that is stimulants, tobacco, stimulants, narcotics, etc. Because these are the entities which will affect the action of your medicine. And that's why it is so much necessary to ask regarding all those details. If you ask casually, is there any, do you have any addicted to anything? Patient says, no, not at all. Then you ask whether you require tobacco, misery. Doctor, I like only tobacco. Yes. Then patient says directly no, and then if you ask specifically, they say yes. That's why you should be very specific regarding the asking the question. Whether you have habit of tobacco, you have habit of misery, you have habit of alcohol, you have habit of taking any drug, ask specifically. That will give a detailed history. So that is one part. If patient is addicted to tobacco, you must take that rubric, tobacco desire for. That is one rubric because that is diseased desire. That you have to take into consideration to find it out of constitutional remedy. So clinical history, many points are necessary. Few of them today we have discussed. In tomorrow we're going to discuss furthermore. I think within a day or two we're going to finish this big chapter of Stuart Close. So that's all for today. We'll meet again at 8 o'clock with next remedy from cannabis, that is cannabis sativa. Yesterday we have finished cannabis indica. So today evening at 8 o'clock, meet again with the cannabis indica and tell other students also to attend the session so that they will learn these very important work done by Stuart Close on all those philosophies. So thank you being there. If any query is there, we can have a chat. Otherwise, we'll finish. Is there any question? So we'll meet at 8 o'clock. Thank you.
Thank you, sir.